Hello, class. Professor Sinetos here. So we're at the end of week two. We completed week two, and we're moving into week three. I apologize. This is a little bit later than I'd like to do the wrap up, but I've been unable. This respiratory thing is taking me a little bit longer than usual to get over. Okay, so the wrap up on week two. Obviously, we were, and I have a couple of pages of notes that I'm going to be referring to here. There were reporting requirements, and so you were asked to list the regulatory documents for the countries that you were assigned to. Needed to conduct the trial, list the regulatory documents for providing updates, and then compare it to another country. So the things that you're going to look for, everybody did a pretty good job of doing exactly that. The key to something like this, if you're working for a sponsor, the likelihood is if you're involving a whole bunch of international countries, you're going to be having a CRO that's likely to be doing that. And within the CRO, you're going to have regional or, depending on the size of the country, country or regional, I wouldn't say call them heads, but they are going to be maybe a country project manager that's going to be reporting to the senior project manager that's going to be overseeing the entire thing and then reporting into the sponsor. And within that region or within that country, they're going to be responsible for reporting everything. But as the senior, assuming that you are the senior PM, it's important that you have a good understanding of exactly what these requirements are, and more importantly, the timelines. And so, organization of all of that information is extremely important. And that's where the Gantt chart that we go into week three, which I'll be talking about in a few minutes, comes in. But that's not the only way. There's a constant evolution, of methods of being able to keep track of all kinds of timelines, because regulatory authorities are get grumpy when you miss timelines and you make yourself a target for audits and whatnot, especially if you do it more than once. So a few other things to keep track of, or to be sure that you keep in mind when you're looking at a whole bunch of countries, especially if you're looking at, I did a study where I was involved with 32 countries, and you really need to keep that stuff organized and have an understanding of what particularities, is that a word? What particulars for each country there are, so nothing is missed. So a few notes that I have. Look for anything unusual or difficult if your regional project manager, if you have them reporting to you, be sure that they can tell you that, pass that along to you, so you have an understanding of an awareness that exists. Confirm that the information that you have is correct. Do not rely on historical data, historical information, because there are countries where this is constantly changing often. And the last thing you want to do is look at, this is the data that we've been, in the information that we had from 5 years ago that we've always been using, and all of a sudden, well, you know what, Poland changed the manner and the timing of a lot of these documents, and now you've got nobody to blame but yourself, and that makes a whole lot of people very unhappy if you miss something like that. So confirmation of exactly what all of what you have is accurate is extremely important. How do you submit the documents? Do you submit it through a website? Do you have to? Is there some other way that that happens? And of course, whether or not you have to be aware of whether or not that website goes down. Is it shut down at any given time? If you submit on a holiday, does that count as the date that you've submitted it? You'd be surprised. I mean, some of this stuff seems reasonable to us, will not necessarily be reasonable at the country level. So again, confirmation. These are the questions that you need to be asking, and then getting clear answers for. Is the navigation of that website, assuming it's a website, is navigation of that website and submission easy to do? Is it easy to upload? Is it obvious? Is it need to be in a particular file that you're not that you or your company's not used to dealing with? Does it that are the files that you are normally submitting in need to be converted into another form, another format? Excuse me. Um, let's see. Question that came up from one of the students, one of you guys, was if and this was become obvious to many of you that many countries are moving towards sort of formulating the manner in which the regulatory body is almost mirroring the U.S. And the question was, if so many of us are, or so many other countries are sort of mirroring the U.S., why do we bother to go outside of the U.S.? And it has little to do with actually the regulatory aspect of it, and it has more to do with, well, I guess that not these types of documents, but the regulatory body. If you want to sell the drug, if you want to a particular drug within that country, oftentimes you have to have done research within that country. So the physicians within that country have to have been exposed to it. If you want to market that drug there are certain requirements that have to be met, and that's why we go out of the country. In addition to, sometimes there are cost considerations. So let's say doing research in Eastern Europe is often less expensive than it is doing it in Western Europe or in the U.S. The U.S. typically is used to be considered the most expensive area to do clinical research. It isn't anymore. At least the last time I looked at it, when I was looking at costs, I think it was probably, it was Northwestern Europe. So you're looking at Finland, you're looking at probably the UK tends to be expensive, and maybe France. The numbers fluctuate, and again, it's been a few years since I've actually had to do that. But that was where it used to be. And the U.S. has fallen down a couple of points, but it's still very expensive. But no, there aren't many places that I can think of. I don't know that there's any place faster to get enrollment up and going than in the U.S. Based on the speed in which enrollment will actually occur, combined with the speed of the regulatory process. Now, there are countries in which once you get them up and going, especially say in Eastern Europe, once you get them up and going, while the professionalism and the speed at which subjects are enrolled is incredible. Personally, and this is just a personal comment, I love working with Eastern Europeans. I've had more meetings than I can count with investigators and with not with regulatory people, but say CRO, localized CRO people, as well as individuals from the sponsors that I've worked with or for, and people in Poland, people in the Czech Republic, Estonia. Those are the ones that come to mind immediately. That's certainly not an all-inclusive list, but they've always done tremendous work for me. The regulatory process used to be much longer. The timelines are getting shortened, but once they get up and going, they're just they're incredible. A couple of other points: be sure that there's an understanding of who actually has to do the reporting. Again, these are assumptions and mistakes. They seem obvious to us right now while we're talking very clearly about it, but who actually has to do it? Is it the investigator? Is it the sponsor? Timelines? Is it 24 hours from the time that the investigator becomes aware of an SAE? Is it all AEs or just SAEs? Things like that. Let's see. Another question that came up from a student that from the discussion board is, why do so many countries have an in-country rep? Which is an excellent question, and quite frankly, I have in all the years that I've done it, nobody's ever been able to give me a straight answer. I'm not sure that the answer is entirely clear, but in my dealings, I have been able to surmise that it's probably, and again, I don't know this definitively. This is just my own assumption, is that you have an in-country physician who is who's usually the most respected physician in that country for that particular therapeutic area. So let's say that you're doing a pediatric respiratory study. You're usually it's usually going to be a specialist. They've been doing research for lots of years. They are they're very familiar with the regulatory process within the country. All of the other physicians have tremendous respect for them, and so the regulatory bodies have put their trust in him or her that they are going to be sure that the particular study that they are or that they are endorsing by being an investigator themselves, and that they are putting forth to the regulatory body and saying, this protocol is a good protocol, it's a safe protocol, and the citizens of our country who decide to participate in the study will be well cared for. Now, everybody recognizes that nothing is 100%, but that particular physician will be considered to be your point person. I'm assuming, and I believe, for that reason. I have never met an individual, an in-country rep, who really did not know their business. They are very, very bright. They do this on a very fairly regular basis. So that's probably why that is. Going on to week 3. Okay, so you're creating a country-specific startup timeline in the form of a Gantt chart. Obviously, you need to know what a Gantt chart is, and I have to assume that everybody does if you've been in the industry. And there's also a PowerPoint template that you are to utilize. You're to be calculating the total time to complete all the listed activities to evaluate whether or not the first patient, and this is a very common exercise with every study that you're going to be doing, whether it's international or not. The first patient can be enrolled, or when the first patient can be enrolled, if all of the activities begin, say, on January 1. Another couple of points is be sure that your references are in APA format on a separate slide. That's something that we usually require in all PowerPoint presentations that you need to do. You need at least 3 references, and one of them needs to be a reference, and it doesn't have to be a scholarly reference, but at least one of them has to be a reference that is not something that we've already sent to you. Last point, not everybody has got the experience of dealing with regulatory, so I'm going to a quick explanation of parallel. There's a parallel versus sequential timelines. There are going to be instances, and this is one of those things that you absolutely have to know, and it's going to be a question that comes up every time. Can we do things in parallel? So you may have timelines, or let's say that you have to submit to 2 different bodies, and in the discussion, in the weekly session, it talks about local versus national ethics, which is very common, and there are going to be some countries where you can do these in parallel. So let's say you get to you know what paperwork you need to submit to the local and the other for the national, and you can submit them at the same time. What and the hope is, the goal is to save time. Let's say that the local goes a little bit faster than the national, but you need a national approval as part of the local packet. It will pause and sit until you get that approval from the national. So you get your national ethics approval, and then you combine it with the local ethics packet, and that's the last box they need to check. Job is done. There are going to be other situations in which, and this is actually a circumstance that is not uncommon at institutions within the U.S. Some universities will have you, you will have an ethics approval, and you have to have a budgetary approval. And there are some in which, you can run them parallel, and you have to have the budgetary approval before you can get the ethics approval. And you can run them parallel. And then let's say if the ethics or the IRB approval gets there first, then all that you need is the budgetary approval. Then you just add it on. There are other universities. Again, now you have to run them sequential. So you have to run the budgetary, the contractual aspect of it first, and it has to be completely done. And now it's part of the packet to submit to the university IRB, and then that starts all by itself. And that can take a very long time, and some of the countries will do that as well. So that is very important to know, and that's going to be one of the first things that everybody asks when you're looking at countries, because it's never prevented me from wanting to go into a country, let's say, for the sake of discussion, I don't know that this is still true enough, but let's say I was going to go into Estonia, and the timeline was rather long. If I needed the subjects to come out of Estonia, then I would wait. The other thing that usually happens is that your enrollment is competitive. So if Estonia takes too long, if they take, I don't know, 9 months to get up and going, but your enrollment is so fast that it's done in 8.5, then I'm sorry, Estonia, but you guys took too long. After a while, they'll begin to adjust their timelines or begin to adjust their processes such that their timelines don't take that long. And that has happened to me before. Never with a country, but it has happened to me with universities, where they just, I still remember a physician who really wanted to be an investigator in one of my studies, and I was happy to accommodate him because I happened to know him. I thought he was an excellent physician and investigator, but university he happened to be working at the time, I think they took 14 months. I think that's what I remember. It took them 14 months to finally get approval, and when he called me up, I just finished my enrollment, I think it was about 3 days earlier, and it made me, it was a hard conversation I had to have with him about that. But, he understood, and that was that. So, any questions? Obviously, you know how to reach out to me, and otherwise, good luck, and we'll see you on the discussion board.